When I diagnose a new condition, I like to educate my patients as much as possible. My name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. This is my patient education on eczema. Eczema is not like an ear infection. Take an antibiotic for 10 days and be well. It's more like diabetes. You need to make lifetime changes in your lifestyle and do medication in order to stay healthy. I suspect eczema in patients that have red, rough areas of intensely itchy skin that recur. Parents will tell me they can hear their child scratching from across the room or in the middle of the night while their child is asleep. In infants, eczema usually starts on the cheeks and then moves its way down the body. In older children and adults, eczema likes the front part of the elbows and the back parts of the knees. Eczema is a chronic skin condition, meaning that it can be present for days, weeks, months, or even years, or your lifetime. If it is severe, it can be present constantly. But in most people, eczema comes and goes. Every few days, weeks, months, or years, you can get a flare, which usually starts as an itchy spot without any rash that you scratch. The skin then turns red, the redness turns rough, the roughness then starts to raise. Due to the intense itch and scratch cycle, you can even see areas where the skin has been scratched off. Eczema is very difficult to treat because the cause is different for every person. It can flare due to heat, humidity, sweat, or even dry air, perfumes, fragrances, periods, stress, anxiety, depression, or it can just flare for no reason at all. With eczema, it is important to keep track of when and where on the body the flares occur so that you can treat it before it gets intense. Treatment is based on the cause. The main cause of eczema is an inability of the skin to moisturize itself, causing extreme dryness. So the first step in treatment of eczema is finding the right cream to externally lubricate the skin. Since the skin cannot grease itself, you have to grease it always, every day, multiple times a day. Use a cream that is completely fragrance-free, perfume-free, hypoallergenic. Some of my personal favorite creams are Vaseline, Vanicream. You do not have to use a cream that is special for babies or children. You can use an adult cream as long as it's fragrance-free. Be very careful about buying any creams that are organic, since many times they use herbs like chamomile and lavender, which can cause severe flares in children and adults. I tell my patients to moisturize their children's itchy spots every single diaper change. And as the kids get older, I tell them to keep cream in their backpacks, pockets, car, in the bathroom, and in every room in their house. If the skin is getting enough lubrication and there's still areas of eczema, then we can add medicated creams. The two creams that I usually use are steroid creams, which start with the over-the-counter 1% hydrocortisone and go on to stronger prescription steroids. These are used twice a day for 7 to 10 days. These are emergency medications to be used in addition to, not instead of, moisturizers. There are also non-steroidal medicated creams that can be used on a daily basis to help prevent the intensity of the flares. Unfortunately, these tend to be very expensive and many times are not covered by insurance. In addition, cool baths and dilute bleach baths have also been used in the treatment of eczema, especially eczema that is severe and possibly contaminated with bacteria. I always try to find the cause of eczema for my patients. An allergy check for pollen or food allergies. If my parents do not want to do the blood or skin testing, they can try elimination diets, removing high allergy foods like milk, eggs, soy, and nuts for a month or two to see if the eczema improves, or they can opt to treat for pollen allergies with antihistamines and steroid noise sprays daily and see if they make a difference. A dermatology referral for patch testing to see if chemicals are a culprit are also a possibility. Bottom line, if your child has been diagnosed with eczema, expect it to be chronic, for it to flare on and off, sometimes their whole lives. Try to figure out the cause of the flares and try to treat the eczema with moisturizers first and foremost. The more often the better. And if that doesn't work, then add the steroids or the non-steroidal anti-inflammatory creams.